안녕하세요. 정승기 정형외과 의원 정승기 원장입니다. 오늘은 독일에서 오신 카스텐 박사님을 모시고 충격파 치료에 대하여 알아보겠습니다. 카스텐 박사님, 안녕하세요.
Hello, doctor. My pleasure.
카스텐 박사님, 본인 소개 부탁드립니다.
My name is Karsten Knobloch. I'm in South Korean, also known as Dr. K. I'm a professor for general surgery, for plastic and aesthetic surgery, for hand surgery, for rescue medicine and for sports medicine. I am currently the Vice President of the International Shockwave Society ISMST, and I'm the General Secretary and the past President of the German Shockwave Society DGEST. I am attending now for the fourth time South Korean meetings, and I'm very happy to be here for the first time introducing EMTT in this very venue.
충격파 치료가 발견되고 나서 닥터 K 선생님은 근골격계 질환, 미용, 재활 등 여러 분야에서 충격파 치료를 오랫동안 해오셨죠.
So I started my shockwave career in 2006, so it's 17 years ago when I was working in the plastic and hand surgical department in the University of Hanover. I was very interested at that point of time in tendinopathies and in burn injuries, so I saw in literature that shockwave might help even in these early years. So I bought in the university a focused Storz dual-lid machine with a focused probe only, and I started with the first patients in 2006, and this was a patient with a Lederhose disease, which is a nodule on the palm of the foot, on the plantar side, which might be very painful, and I treated her because she already had surgery before, unsuccessful, and that's my start of the career. And then in the beginning I started mainly in the field of plastic and reconstructive surgery, so I did preconditioning for free flaps, I did burn injuries, I did hand injuries, and that's how I started in the first 6-7 years. Then becoming more into the orthopedic MSK business, and later even in the cosmetics. And now recently I started 2 years ago or 1.5 years ago with a NeuroLit, which is treatment with shock waves navigated on the brain. So over the past 17 years I had a lot of chances to experience how shockwave works.
충격파 치료를 여러 분야에 적용해 오면서 치료 효과에 대하여 특별히 만족하고 계시고 있는지요, 지금?
When I started, as I mentioned, in 2006, we had no literature, we had no workshops, we had no education. So in that point of time, we were very pioneering even on new indications. And we had a close feedback of the patients and looked how we could improve the results in different tissues. So as I mentioned, I treated free flaps, skin, muscles, bones. And we learned over the years that with proper management and proper learning, we could improve the results quite tremendously, both for bones, for tendons, for muscles, even for nerves and for skin. However, still, if we consider radial and focused shockwave, there is always room for improvement.
충격파 치료가 특별히 탁월하다고 느끼는 분야가 있는지요?
So one beauty of the shockwave is the non-invasiveness and the less or the lack of complications. So if I consider in my practice, which is dealing a lot with sportsmen, especially adolescents, athletes suffering from Osgood-Schlatter disease of the knee, for example, or heel pain when they are 8 or 9 years old, benefit tremendously from radial and focused shockwave because it's non-invasive. It is not painful if you take or apply the correct or perfect parameters to the patient, and with the perfect applicators as well. And the non-invasiveness helps the healing in these cases quite tremendously. And the same holds true if it comes to professional athletes, for example in soccer or in other disciplines where doping is an issue. And there are a lot of sportsmen who are trying to avoid any kind of injections before a competition and so on. And this is another very set of shockwaves where shockwaves really make a difference to different treatment modalities we are aware of.